We're back with Dr. Joseph Gathe Jr. Once again, thank you so much for continuing to do this coronavirus series with us and continuing to update us as you continue the fight against this pandemic.
Thank you for having me back. It's always a privilege.
So my first question for you, we had our first virtual draft ever, I believe, with the WNBA draft. The NFL draft is going to be Thursday. The NBA playoffs would have started yesterday. Some people believe that sports will be back in the United States soon. Other people believe that there is no way to finish seasons the longer we're in lockdown. The leagues with the most realistic plans right now are the MLB, being that they have a plan where 30 teams will play in Arizona throughout the entire season, and the NHL will have all 31 teams play in North Dakota. With sports, there's so much power in the industry itself to promote change and to set an example for society. What would you like to see American sports leagues do as coronavirus continues?
Well, hopefully they can set an example for how we can return to some degree of normalcy safely. And again, we're all wrestling with that in all of our communities because really no one knows how to do that. But our sports teams are, first of all, important for us to bring back, to have some degree of normalcy where we can look back and have something to do other than watching, old movies and things like this. And the sports teams have the infrastructure and the power in order to be able to bring back an organized effort. So I'm hoping they'll be able to do so. It sounds like they're thinking through it appropriately. I think the direction they're going makes some sense. I just don't see, until we have our cities and communities back in better shape, that we're going to be attending these events live anytime soon. But we can do it in a situation where teams can play, the players are safe, namely they've been tested as best we can tell are COVID-19 free, or at least over the disease process if they've had it, and they were not putting them at risk, or the officials, refs, things like this, then I think hopefully we'll be able to come back with something in this fashion. And to your point, I think it's going to be Major League Baseball, probably the NHL, and hopefully shortly thereafter football. I'm not sure I see the NBA season coming back because it's going to butt so closely to the new season. I'm not sure how we're going to be able to resurrect this one, but at least those, hopefully they'll give us an idea of an infrastructure, things that seem to work to bring us back to some degree of a return to normalcy in our communities.
Yeah, and I agree with you. I think that it's going to be interesting not only to see players not playing in front of fans, but also playing at a neutral site for the entire season. If that is to happen, I think it is the most comprehensive plan that we have with the MLB and the NHL. It is going to be an interesting strain, if you will, on the families and the athletes, but at the same time, you do have to play it safe in these conditions.
Exactly.
Is it possible that there may not be a full return to sports until next year?
I think that is not unrealistic until we have some idea of what this next wave of COVID-19 is going to look like, if we're going to have a wave at all, which we all think that we will. So I think realistically, it's probably not going to be until we have an effective vaccine that will allow people to return to large venue settings and sit together. But it's not just them, it's the people, it's the concession workers, it's the ticket takers, it's the officers. There are a lot of people involved. It's not just us fans and the players out there. There's a whole group of people that are potentially putting themselves at risk. And I think we'll probably talk a little bit about the African-American community and being disproportionately involved in this. And our communities are disproportionately involved in jobs like this. Our ushers, our ticket takers, our Uber drivers that drive us to the game tend to be overrepresented in minority communities. And if we're at more risk for the disease, then that even makes it more of a concern about protecting that segment of our society and not letting them get in a position to get sick.
Yeah, and I definitely want to visit the issue of COVID-19 disproportionately affecting African Americans, because I know you've talked about that throughout the past couple of weeks, and a lot of people are bringing up that issue as well. But I do want to continue on the sports vein first. there is a country that is still allowing their athletes to participate in sports, and it's the Premier League in Belarus. Belarus is currently the only European country still playing football, and all their players are still continuing with the regular season as normal. And there's a quote from the head of the Belarus Football Association, and he does not believe there is a reason to stop playing, even though the country has 5,000 cases. Why do you think there's such hesitation from this football association to stop playing amid this pandemic?
Well, unfortunately, we're seeing that throughout the world. Even here in the United States, I think you're already seeing protests for we don't want any more lockdown. We all want to get back to out there and not doing the social distancing. So we're going to have dissenting people that are doing it not for the right reasons. Whatever the reasons are, it is not in the best interest of the players in this community to continue to have that behavior, because he's putting too many people at risk. And it's just, it is up to our leaders and our government officials just to say that we're not going to tolerate that puts other people at risk in our community, so we have a better idea of how to handle the epidemic. And so we're going to see those people out throughout the world. We're going to see them in the United States, and that's a very big fear, because it just takes one group of people to get infected to spread the disease process amongst those of us that are trying to do the right thing. And so I have my hats off to our sports leaders and communities in all of the sports that have not bent to that kind of response and have done everything they can to put everyone in the safest position they can once it's time to reestablish our sports and our communities.
I think in terms of dissenting, that is a huge concern. Another huge concern is that Florida is considering sports an essential business, which affects the WWE, it affects AEW, NASCAR, golf. And we're also seeing that Florida beaches are opening, particularly in Jacksonville, where we saw hundreds of people gather within 30 minutes of the beaches opening over the weekend. Governor DeSantis wants people to, quote, enjoy the outdoors to be able to get out of the house. Should sports be considered an essential business?
No, the only essential businesses are those that make sure that the community stays alive. It's our healthcare industry, it's our food industry, it is our essential personnel that keep us safe, our policemen and our firemen. Those are the only things that are essential. Everything else, while being nice to have, is clearly not essential. And this is back to our leadership to say what is essential, what's not, and to which degree we open things up to things that are less essential but not necessarily necessary. And until we have a organized effort to be able to test people, to track people, to see who's infected and who's not, everything else puts everyone in our communities in a dangerous situation. And it raises the concern that we're going to be back to where we started now. It means we have to do all of this all over again. And I don't know if our economics and our society can stand another long-term lockdown if we have to go back and do all this again. And to say we have to do it just for a small group of people that feel like they need to go to the beach or feel like they need to go to a sporting event or feel like they need to protest something that clearly needs to be done and to save so many people's lives is not in the best interest of anyone in our communities, and it's going to downgrade our societal response that has been so far relatively effective in decreasing the spread of the disease process. And again, I want to continue to emphasize those at most risk are communities of color, because those are the ones that are differentially affected. And so as we look through all these people coming back, you're putting communities of color at more risk than the other communities in the country, which is that we shouldn't put any community at risk, but the fact that it's differentially affecting us is going to make it even more difficult to make sure that we get control of the pandemic and stop the loss of life.
I think that social distancing has been effective, but we can't look at it in a short-term setting. I recently saw, it was a cartoon where it's like, you wouldn't take your parachute off if you're still in the air, thinking that, oh, okay, my landing has softened, but you haven't landed yet. And I think that we're still in this phase of we're still very much in the middle of the crisis. We're not out of the woods yet.
Yeah, I think Governor Cuomo said it best. At most, we're at halftime. At most. Mm-hmm. And if we don't play the third and fourth quarter the way we played the first and second quarter, we're going to lose the game. And I don't want y'all to bring my Texans references with that, but it's a similar kind of thing. We won the first two quarters 24-0 almost, and sort of we lost the game. We don't want to lose this game because we've come too far and it's too important.
Right, and I'm sure, the Texans were thinking the same thing on the other end with the Bills, even before the Chiefs. But speaking of, people with pre-existing conditions, I know with, Florida, when they talked about the WWE, the first person I thought of was Roman Reigns, who is a leukemia survivor, and how he has pre-existing conditions. But groups of people that have pre-existing conditions particularly involve communities of color. And you said this morning on the local news that the Black community represents 12% of the population, but 33% of hospitalizations. And Beyonce, fellow Houstonian, even quoted a report saying that 57% of fatal cases within the Houston city limits are African American. Why is COVID-19 disproportionately affecting the Black community?
Well, I think there's a bunch of reasons, and that's not just one. The first is that African Americans are 30% more likely to have pre-existing conditions of diabetes, hypertension, obesity, kidney problems, et cetera. So that automatically puts us at risk. We're overrepresented, as I've said before, in what I call high contact essential services: bus drivers, waiters, police officers, nurses, beauticians. So we are in jobs where we cannot effectively social distance. And so we're putting ourselves in a position to get exposed. We tend to live in high density population centers and multi-generational living conditions. Many of my patients are taking care of their mom who's 80 years old at the house and they're all living together, or you have siblings that have moved back into the home. So we have places where you can't social distance in the home setting. So if you take account of a group of people that can't social distance, they have 30% more pre-existing conditions, that live in situations like this. And I haven't got into the racial bias of healthcare in America, which is a whole nother segment that we can probably have a whole nother podcast about. When you factor that in, we simply don't get tested. We don't get into healthcare when tested. And when tested and we try to get into healthcare, we're often turned away. I had a patient just today that called for a second time, a young man who has pneumonia, 104-degree temperature, and was turned away from 2 emergency rooms and told to go home, and clearly just listened to a story he had COVID-19. These people are going to end up dying, and they are dying at home without a diagnosis. And so the numbers that you see of people dying are a underrepresentation, because those are the only ones that actually made it to the hospital. So the numbers are actually worse than that. Now, is there any genetic reason or the scientific reason? There may well be, and somebody's going to need to look at that, but that's going to be something that we're going to learn a year or two down the line. We're not going to know what that genetic predisposition is now. And so as I tell my community every single day, we have to social distance more than other communities because of who we are, where we are in the community, and what we represent until we get ahead of this disease process. And as we open up the communities again, because we're at more risk and because we're going to have jobs where we can't social distance, we have to have access to testing to know whether or not we've had it before, and importantly, if we get exposed, whether or not we have it, so we can get treatments earlier than before we get sick. And so all those things are playing a role. And, I just, unfortunately, in the Houston community, don't see enough of the social distancing. I'll give you a perfect example. I took my clothes to the cleaners to drop them off in my little bundles, and the young lady came out with no mask, no gown, no gloves, no nothing else, and came literally within, I had my mask on, but within 3 feet of me for me to sign the paper. And I said, young lady, you're doing this all day. I happen to have a mask, but other people are going to be coming here and potentially can give you the virus. Are you concerned about that? Well, you're probably right, but I'm not real concerned about it because I don't know anybody that has it. Well, that's why we end up getting it. And so we have to get the message across that we cannot put ourselves in a position to get exposed until there's a vaccine or a cure or a treatment or a cure. Put your mask in your pocket, wear it when you have to. And then you have to demand from your employers when we go back to work that we have some kind of program where we can't wear a mask and can't be socially distant to some kind of way to be protected. We need to get testing, and that has to be ramped up. I think everyone has seen that on TV now. Everybody's complaining we don't have access to testing. That's absolutely true, and we cannot bring our communities back, and most certainly can't bring our communities of color back until that access to testing is readily available, because we're putting everyone in our community potentially in harm's way without that information.
Yeah, and hindsight is 2020, and I think that we're definitely going to learn a lot about COVID-19 and its impact, especially on communities of color. But you brought up a good point about testing, which is a perfect segue to my next question. President Trump unveiled a 3-phase plan Thursday to reopen the country, and less than 1% of Texans have been tested in a report from KPRC Channel 2. And Texas is under testing in spite of being the second most populous state in the country behind California. Georgia is also under testing out here, and 1% is the national average of tested citizens nationwide. Plus, the US still has the highest number of infected patients on planet Earth. Why are the percentages of testing so low in this country?
Well, it's complicated. I'm going to take you one step back from that point. Even the tests we have, we don't know if they work or not. There are 90 different companies that have flooded the market with test kits. Most of them are from China. We have no idea if they work. Some of them are only 20% effective. And not only do we have lack of testing, we have testing that you can't interpret. Imagine getting a test that's an 80% failure rate, but you're walking out and saying, oh my God, I'm just fine because this test is negative. So we're back to not having an organized structure. Once we do have a test that works or looks like it might work, we don't have the infrastructure in order to be able to push that test forward. You have to have a person to do the test. You have to have the apparatus to do the test. And depending on what the test is, you have to have somebody to run the test. And there are problems depending on where you are with each one of these things. Our testing sites in Houston, for example, a couple of them have enough tests for 250 people, and then they run out of kits. They don't have enough swabs or whatever else. If you're number 251 in line, guess what? You don't get tested, even though you may have 102-degree temperature. And so we have not organized like we should. How should we organize? Go to Germany. Germany, in their wisdom, says, look, we have a problem. They went to one manufacturer and says, we need a test that's over 95% effective. And their schools or wherever made the test got that test up and running in 2 to 3 weeks. They got virtually almost everyone tested in Germany that needed to be tested, wanted to be tested. What they test is 95% accurate, and they have a much better control of their pandemic than we are here. Now, unless we have something like this, it's gonna be a problem. And I don't see, unfortunately, that. One of the tests that looks like the best calls Abbott, the Abbott test that people are looking at, we need 50 million of them. There's no way that Abbott is going to be able to do that for the numbers that we need. And so the whole entire infrastructure of how we're doing this is not where it needs to be. And unfortunately, I don't think it's going to be where it needs to be anytime soon to bring our communities back. And so what we have to do, and I'm telling them on a local level, is in Houston, is we can't go back to lack of distancing from each other until we have adequate testing that is reliable and can be reproducible. And at least our leaders here in Houston are listening to us, and I think they're going to make sure that that part and a component is going to be where it needs to be. But a whole lot of work has to go on in order to be able to get this effectively accomplished in most communities, particularly here in Houston.
Why is the testing so ineffective? You mentioned that it's only 20% effective, and sometimes it's really hard to read. Why is that?
So there's 2 tests. There's a test called a nucleic acid test that tells you whether or not you have the virus in your system or not. That test is a nose swab test. And the reason why that's inefficient is it depends on how good the person sticking the swab is in your nose. If you don't stick the swab deep in your nose and inflict some degree of pain and get some cells out, when you put it in there, the test may not read because you have to have enough cells in there in order to be able to read. And so a lot of the problems with the testing that we call nucleic acid or PCR testing is operator dependent. So the 40% failure rate is often that. Also with that test, it can take 3 to 5 days to come back, which takes a while, so you don't even get the answers on real time. We're hoping that some of the newer tests gets around that, but we don't know until we get the test out in the community. The second test is an antibody test, which is a rapid test. It's a little bit of a blood test. You put it on a reader, and it reads like a pregnancy test. The benefits of that is it's quick. It can be read in 15 minutes, but the downside of that is that if you've been exposed, it may take over a week, if not longer, for that test to turn positive. And still some people never turn positive, even though they have the virus. And so again, the performance dynamics of the test are what the concern is. The best way to do it would be to do both of those tests in conjunction, so that one misses it, the other one will pick it up. But then that means you need to be doing 2 tests in people and not just one. As we open up our communities, let's say you're a maitre d' at a restaurant and you've got to greet people and you're negative today, but if you greeted 50 people that you set at the table and they're coughing on you, you need to be tested again, and maybe need to be tested every week or every month. And so as I'm saying, you need to get one test. You may need to get multiple tests depending on what your job is, but we can't even get the first one at this junction. So those are the things that have to be solved beforehand. The good news is I think people are understanding this and ramping up. So I'm hoping this deficit, if you will, in the ability to test will go away, such that at least we'll have the infrastructure or what needs to be done. And then that infrastructure has to be scaled up, if you will, to make sure we get enough tests to enough people. And then our community, we have to go get tested. Right now, we have free drive-through testing, and I have to fight, if you will, with our community members to go out and get tested, even though it's free. Yes, we have to stand in line for a bit, or our drive-through sites may take a couple of hours, but our life depends on knowing what it is. So even in the face that the test is free, we still are having difficulty in getting people to come out. So it's complicated, but we as a society have to respond, because if a small segment doesn't, then we're all potentially doomed to repeat all of this again.
Yeah, and I think it's really important to emphasize that in addition to the fact that there already is a shortage of testing kits nationwide, and that, healthcare workers just like yourself are putting yourselves at risk every single day. And, if there aren't enough people to treat us, then, Lord knows how much longer this is going to go on. So to your point, it is a very complex issue with it's very multifaceted, and it is worrisome.
No, it's very worrisome. I'm very afraid. I've been asked a lot on how we're going to get around this, and it's not going to be easy, and there are going to be people going to get infected again. We just have to make sure we get those numbers as low as possible, and those that get infected, we have to make sure they get into healthcare very quickly. And that's another example I gave talking to somebody yesterday. We have to make sure that if you get exposed on your job, that your job allows you to go home and get well with pay. I'm back to restaurant maitre d'. If you get infected on the job, I don't want you to go to work and cough on anybody, but you can't go home and sit for 2 to 3 weeks without a paycheck. Or you may lose your job because you're sitting at home for 2 to 3 weeks. So there has to be some guarantee that if you're at a high density job, for want of a better word, that if you do get sick, that you'll be able to be supported until you get well enough to go to the job. Otherwise, what's going to happen. I'm going to have 102-degree temperature, but I need my job, so I'm going to go work at that restaurant because I can't afford not to get my paycheck, and I'm going to go there and cough on a bunch of people, and we're going to have, again, another mini epidemic. And so all of those things have not been answered at this point, and it needs to be answered on a society basis that we can make sure that those that do get exposed in the workplace, they'll be able to get paid for their time that they have to be away, and they won't lose their jobs and they'll have their jobs coming back.
So when should people be tested? Should they wait until they have symptoms?
No, well, That's another complex thing. That the answer is no, you shouldn't wait. The problem is we don't have enough testing for the symptomatic people. And so the tests are being reserved for people that have symptoms. If you look at our testing centers here in Houston, many of them make you go online and make sure you have some kind of symptom or a doctor's order before you go get it done. And that's important because we do want people that are having symptoms to be diagnosed so they can go into treatment. But if you have a group of people that are asymptomatically spreading the virus, for a surveillance purpose, we want the testing done so we can make sure that that person that is spreading the virus we can make sure, one, they're quarantined, and we can contact trace those that they've been around. But again, contact tracing is very difficult. How are you going to track down the people you've been around for the last 2 weeks if you end up with COVID-19 today? You're going to have an army of people to do that. And so the right answer is we need enough tests for everyone. But the answer now is we only have enough tests for those that are exposed and sick. And the other ones, the ancillary ones, got to be done down the line. But that's back to we need to ramp this up as quickly as possible, especially in communities like here in Houston where we haven't hit our peak or our surge. The good news in New York, they're coming down on the other end so they can do more surveillance than sick people, so to speak. But we need to do it now to make sure that we decrease the spread that's happening now in communities such as Houston, where we haven't reached our peak yet.
Yeah, and to add to the complexity, I know it's something that nobody likes to think about, but we are 6 weeks away from hurricane season. What should people do to prepare for hurricane season in light of a pandemic like this?
Oh my gosh, it is. That's a good question. If a hurricane is coming this direction, we really have to make sure that we have ramped up and figured out who, as many people as had COVID-19 as not, so we can make sure that those people are one, taken care, and two, there's a hurricane, we put a COVID-19 person in with a multi-generational household and ride it out. Everybody in that house is going to get infected unless we know that that person is positive. So I say that to say, if we had a hurricane tomorrow, we'd almost have to assume that everyone in your house has COVID-19 until you can get out of the house, unless you 100% know that they don't. And that means masks and gowns and gloves, not gowns, masks and gloves and a lot of sanitizer until you can get out of the situation. And that's actually not one I had on my radar screen, but you just depressed me more about something we have to think about. Now, I think I saw a report we may have a busier than usual hurricane season this year too. So that's maybe a problem. But I'm hoping that by the time that hits, and it tends to hit more in August, September, that we're going to be in a better position with a lot of things that we have spoken of.
Yeah, and I mean, to your point, I read the same report that it's going to be a pretty busy hurricane season compared to other years. It might be the busiest since 2005, and just going through Hurricane Rita in Houston, or even having, friends and family coming from New Orleans after Hurricane Katrina. I mean, that was a hell of a season in and of itself, just in terms of the devastation, having to rebuild after the aftermath. And we can only imagine what it would be like with the pandemic. I really hope it doesn't come to that, but everybody has to be prepared in some capacity. But being that it is on your radar screen now, has the medical community begun to think about this as a whole? Are there plans in place, or is it just so overwhelming that no one's thought that far ahead?
Well, nobody's thought that far ahead. We're just trying to make sure that we have enough beds available for people that may get sick over the next few weeks. And we're trying to ramp up our infrastructure. I think if we ramp up the infrastructure and get the testing where it needs to be, I do think that we'll be much better prepared during hurricane season to be able to have a better handle on what this could be on top of that. But there's been so many things, trying to get people tested, trying to get people treated, trying to get enough personnel out there, trying to get enough PPEs to make sure that we can not just do testing, but take care of patients. There's just so many things on the radar screen. And just trying to get the message out about the social distancing. There's just so many things we're trying to do at once that hasn't been a prime topic, but as we get closer through the summer, it's going to obviously have to be one. And it makes this more real that we have to do this as quickly as we possibly can.
Yeah, and speaking of PPEs, I do have some questions from our audience.
Okay.
Someone wrote in, how are you managing your supplies and your PPEs in your practice and in the hospitals?
Well, that's a good question. So my practice is both an inpatient and an outpatient practice. The problem with my office practice is you don't know who's coming into the office that may have COVID-19. So because of that, we have stopped seeing patients live in the office for the protection, not necessarily of me, but my front desk people that are, greeting patients when they're walking in the door. We've switched to completely telemedicine. Which for an old guy like me is a little rough, but I've got young people to turn my computer on so I can see people. And actually, that's worked out very well. That's not only kept us safe, but it's kept people having to transition to my office that I often have to come by bus or Uber or whatever else. They can stay in their homes and we can have a visit. Because most of the things I need to discuss with a patient, 90% of them can be discussed like you are not speaking. If you look like you're sick on the other end of the line with fever, then we need to get you to a healthcare setting where you need to see. And so we've transitioned to that for an unknown period of time. I'm doing it week to week until we see where our surge is going. So that's changed that. As an inpatient in the hospital, it's becoming more difficult. And what I've told nurses in the hospitals I work with, you almost have to assume that everyone walking in the door potentially could be COVID-19 until you know that they don't. And so you need to, whatever gear you need to do before you walk in the patient. I don't care if they're coming in there with a sore foot. If they have a little bit of a cough, they have COVID-19 until proven otherwise. And our testing in our hospitals is not as robust as it should. We still have issues where it takes several days to come back, which means people are laying there, albeit in some type of isolation, but unknown about whether or not they have the disease process. And so the issues in the hospital is we need the rapid testing we've talked about, and we need to try to conserve PPEs. We waste PPEs if we have to wait 5 days for a test and somebody that doesn't have it, but I don't have the test back for 5 days. You have to wear PPEs every day for that person that actually didn't need it. And other people that you don't think they had it, all of a sudden you realize they've had it, and then the nurses now have to go home and be quarantined and can't come to work at all. So it's very, very complicated. But right now, the testing, in my opinion, should be each and every person that is coming into a hospital setting until you know that they don't have it. And that's a major issue. We're struggling our PPEs. We're having to, I don't know right where just recycle, but we're having to just to make sure that we're not utilizing more than what we have. We have enough now today, but if we get a surge, we're going to run out of gowns, we're going to run out of nurses and ancillary personnel. It's complicated to take care of one COVID-19 patient. Imagine if you're on dialysis. One of my patients had dialysis, we have to have a complete dedicated dialysis machine just for that one patient, when the hospital only has 3 or 4 dialysis machines. Well, if you have 4 people on dialysis with COVID-19, you just can't necessarily move them in between the patients. So things like this that you don't even realize are things that we have to sort through. And it's like moving, chess pieces on the board to make sure you got enough and you're not getting checkmated as far as what patients need. So we're surviving so far, but a big surge would, unfortunately, I think, push us over the edge.
It really sounds more like Tetris at this point, just trying to, make sure that things don't get stacked all the way up to the top and things hit the fan. I have another question from the audience. How are you treating patients at your current facility? I know we talked about Z-Packs in a previous episode. Is that still something that's being used?
Well, let me try, and this is my opinion, because you're going to get a lot of opinions because nobody really knows. I think there's 2 phases to this viral process. The first one is that you get the virus in your system and it grows. If you take an antiviral medicine at that time, I feel that you can mitigate the damage that the virus is going to do. The equivalency is what people understand about Tamiflu. Tamiflu is a medicine. If you get the flu and you take Tamiflu in the first 48 hours, it'll make the disease process not as active. But if you take Tamiflu 5, 6, 7 days down the line, then it's too late. Well, I think it's similar in COVID-19. If you take an antiviral early on, you can slow the viral process and you don't end up getting the damage down the line. That's where I think drugs such as hydroxychloroquine, Zithromax, and drugs like this may work. If you wait too long and the disease process has progressed, then what you end up having is your body beginning to respond to the virus. And the people that get sick have this overabundance of a reaction to the virus. And that's what causes the damage, not the virus itself, but this overexuberant response. And so taking an antiviral there may help get rid of the virus, but it won't control this overwhelming response. So when you get to that point, that's when people are starting to go on ventilators. And you have to have a medicine to control this inflammation. And that's where we're back and forth in our medical community about what to do about that. One approach is to give steroids, where people say, well, you shouldn't give it too early because it'll make the virus go too fast, but you need to give it before this happens. But the only way you can do that is to watch the patient in the hospital, because you don't know who's going to get this and who's not. And that's back to, do we have enough beds to be able to watch patients? And so my general approach, if I think that you have it and I think you may get symptomatic, I'm going to start those antivirals. And we've been very successful so far. Praise God that none of our patients have had to go on a ventilator if I've been able to treat you early on. And I've got some medication that we're using to try to block this cytokine storm that happens in order to be able to turn the process off so people don't get to that point. But it's got to be one where people have to be watched. And again, back to the African-American community, we come to the hospital late when this response is like this. And that way, that we call it in Texas, the horse is already out of the barn and you're trying to close the door. It may be too late, because you get this overwhelming response. You already have hypertension, you already have diabetes, you already have asthma, you're already obese, and you get this on top of that, then it ends up being very difficult to control. So while we're all looking at studies and things, people are dying now, and you have to come up with some kind of program that makes some sense with the treatment. And so my approach is that, but again, to the audience, the earlier you get into healthcare, that you know you're positive, the quicker we can figure out if any of these things will be most appropriate for you.
Wow. Yeah, I think that's an interesting thing to point out. You're the first person to talk about the response to the virus rather than just the virus itself, and how that is a huge impact in a patient's care. Someone else asked, how long can you be an asymptomatic carrier of COVID-19?
That's a real good question. We have absolutely no idea, because we haven't tested enough asymptomatic carriers down the line to see. Can you spread it for 1 week, 2 weeks, 4 weeks, 6 weeks? We have absolutely no idea. And that's back to why testing is so important. If you're an asymptomatic carrier, I need to test you every week to see when it goes away, so I'll know when the average person can stop spreading it, go back to work. We have absolutely no idea. The general thought is that once we know you have it, a couple of weeks later, many people stop shedding the virus. But I don't know when it started, because if you're asymptomatic and I test you today, you may have been spreading it for the 2 weeks before I happened to test you, because you're asymptomatic, which is back to why we need to have widespread testing of everyone, so we can figure out exactly what you said. Once you're positive, when can you go back to work? When can you stop wearing a mask in the house? When can you go take care of grandmother because you're the only caretaker without having to put masks, gowns, and gloves on? I get those questions every day, and we don't know. What I can tell you, of the patients that I've seen that have been in the hospital, that have been treated for COVID-19, and we've tested them, 2 weeks later, I can't find the virus. So at least in that group of people, they're okay 2 weeks later. But somebody's totally asymptomatic, which is a different kind of person, we absolutely have no idea.
Wow, that's a stark reality that we're facing, that we're just learning new things about the virus every day, and there's still so many unknowns going on amid this pandemic. Someone else wrote, how should we clean our cloth masks? Now, I know a lot of people are sporting disposable masks, but also cloth masks, whether they made them themselves or someone else made them for them. So how should we clean it? Should it be like regular clothes where you just wash them, or is there an extra step that we need to take?
I would just wash them. First of all, make sure when you take your mask off, don't take it off like this. I see people say, oh, I have my mask, that's great. Hands on it, and they're pulling it up like this. Pull it up from the back, pull it up like this, and drop it in the washer. I would put it, quite frankly, and I don't know if this is right or wrong, but just common sense, I would put it either by itself or with your other potential COVID-19 clothes that you may have been exposed to if you're at the grocery store or whatever else. I would put those things together, but just washing it with soap and water, that cloth mask will be just fine afterward. It'll be good.
Okay, cool. What steps are you taking to remain healthy during the pandemic?
Well, I have an excellent support with my wife, and I want to tell the podcast members that it's important not just to talk about our first responders, but our other halves and our families are putting a whole lot on the line. I think you looked at, if you're watching Chris Como on TV, you know, he's got it, and now his wife has it, and he's not so much discussed about him having it. He is just, you know, so upset that his wife has it. And I would feel the same way if I brought it home. So it's a struggle with families coming back home. You try to do what you can. You make sure that you've done all the PPEs. You take off all your clothes in the garage, leave everything out there, and then you take inventory every day. If somebody has little sniffles or something, you get all nervous about whether or not something may be going on. And so it's difficult, you know what I mean? And it's a scary proposition for me knowing that could happen. That's the first thing. The second thing is I've had to try to keep myself healthy here in the house. My wife, Deanna, has made our garage into a gym. We back the cars out. She has a HIIT program that's harder than my trainer at the gym to try to keep some semblance of health. And you know, she's got a little podcast that she does talking about, we call it social distancing, but remaining socially connected. And we have some things online that we try to do to keep ourselves healthy, both mind, body, and spirit. I encourage your other listeners to look at that. But we all have to keep ourselves healthy in our own ways, because we're all essential people. I mean, you know, I may be a first responder, but the grocery store people, my God, I just saw a report at one grocery store. A lot of the grocery store checkout people ended up with COVID-19. I forgot how many at one of the stores here in town. So there's a lot of people that are putting their lives on the line for all of us, and their families' lives on the line. And so we need to support them and try to make sure they have what they need to stay healthy. But I would encourage everyone to find what works in your household, and make sure when you come out of this COVID-19 negative that you're healthy enough to get back to where you need to be, because we have to get our society back in order and working, hopefully sooner than later.
Yeah, and I'd like to give a shout out to my aunt, your wife. Hi, Aunt Deanna, how's it going?
Hey,
yeah, I'll definitely. I'll drop a link to your series in the description. They did they did like 6 daily videos where they talk about just their home routines with COVID-19, especially with you being an infectious disease doctor. I agree with that sentiment, not wanting to bring that home and spread it to loved ones. It's very, very important.
Yeah, please watch. We put a lot of time into it. It's things we actually thought about, and I think it's important. I think the tips will help, and we also are putting information out there to give us tips that's working for you all, because we want to get that information out to others in our community about what works and what doesn't, and to keep us all healthy and COVID-free.
Yeah, I mean, any little thing helps. If you guys have anything that you want to send, like any tips that you guys have, definitely drop it in the comments below. Let us know. So somebody else asked that a University of Virginia researcher suggested that regular exercise could protect against COVID-19, to continue with the theme of, just trying to stay fit and healthy. Do you have any thoughts on that?
So I don't know if specifically affects you from not getting the virus, but I think it does help you if you do get the virus. The less comorbid conditions you have and the better shape that you're in, the better chance that you're going to get over the virus. There was actually just a show on CNN. There was a intensive care unit lung specialist that was working with COVID viral people that ended up getting so sick he almost went on the ventilator, and he barely got out. And he attributed the fact that he was able to get out because he was training for a marathon, to run a marathon in Milan, believe it or not, in April. They got canceled, but they said the fact that he was in such good shape with his heart and his lungs is the only reason he survived. Now, most of us aren't marathon runners, but if we can do things to keep ourselves healthy and we end up, unfortunately, getting exposed to the virus, we're going to be in a much better shape in order to be able to handle it. And so I think exercise is a good thing as long as you may remain socially distant from the person that you're with. And this is getting back as we get back into trying to get a norm. What are we going to do at the gym? How do you distance at the gym? We got disinfectant equipment each place. I mean, I'm thinking about that now because I want to get back to the gym and what those things are going to look like. So keep your exercise program up. I think it's important for our general health and well-being.
Yeah, and I mean, I think about those things too. Like there were a lot of things that I wanted to do just this year alone. Like, the Peachtree Road Race is coming up in Atlanta. It's like a quarter of a marathon. It's like a 10K, but it's like it's basically like the Houston Marathon of Atlanta, just in terms of the amount of people that come out. Like it's 40,000 people. And,
oh, wow.
Yeah, and it takes place on the 4th of July every year. So, I was training for that, and I'm wondering if that even is going to happen. Not just because it's so soon, but it's just because there's so many people. And it's just it's impossible.
Yeah, you just can't distance from, even though it's a run, you can't distance at 40,000 people, no matter how you. Obviously, you can't wear a mask. So those are the things that we just don't know. Yeah.
Yeah, in the heat, and you got people passing out water, food, flyers. You got the news crews out there, and then you think about just like different classes. I know some people that take salsa classes or like mixed martial arts and other things to keep themselves in shape. Like I wonder if that changes as well. There's just it's so many things to think about.
It's some simple things. Are we ever going to do high fives at games anymore? I mean, what are you going to do when somebody scores a touchdown? The first thing you do, you find the person next to you, bam. I mean, it's just like natural. Now you got to say, ooh, ooh. you have to be Arian Foster or whatever. But, it's all of these things that you don't think about that we do naturally that we may not ever do again. It's a scary proposition.
It is. Or, a lot of Christians that go to church, like, when you shake your hand and say hi to your neighbor, just communion for Catholics. I mean, it's so much.
So many things. Yeah. So many things. Right.
Some positives. I know some survivors of COVID-19 that you treated gave you shout outs on the local news and on the local radio stations. And in addition to all that, Tina Knowles-Lawson organized ministry leaders to send supplies not only to New Orleans, but to your team in Houston. Can you talk a little bit more about how those donations are helping your team?
So the community is really rallying. I got a call at 8 o'clock one night from Tina Knowles, and said I hadn't talked to her in a while. She's a good friend of mine, good friend of Houston community. And she called and said, hey, you know what? I was thinking about you because it was right when the surge was happening in New Orleans, and the mayor of New Orleans had called her to see how, if there's anything she could help. And there's a ministry called Matthew 25 that's in Ohio. That organizes supplies for people in disasters. They responded, I think, to Katrina. They responded to Hurricane Harvey, things throughout the United States. And she says, you know what? So she put them in contact, and a lot of supplies went to New Orleans. But she realized that, we may be having a problem in our community too. And so she called me up to say, hey, can you use some supplies? And as we're trying to build our COVID-19 unit at one of the inner city hospitals, I say we most certainly can. So within 30 minutes at 8 o'clock that night, at 8:30, I got a call from someone from Matthew 25 Ministries to say, hey, I got Tina called. I heard you need something. We'd like to help. What can we do? And I thought as many things, well, they'll call me back in 2 weeks. He says, oh, no, we're going to load the truck up tonight and put it on the road. And so an 18-wheel truck with 40 pallets of supplies for our inner city hospital was on the road within 12 hours of talking to Tina, and came to our facility with personal protective devices, hand sanitizers, all kinds of things that are going to put our unit in a much more safe position than we were before. So shout out to Tina and to our community leaders and our community representatives for standing up. And that's what it's going to take, on a community basis. We can't, you can say what you want to, we can't afford to let the federal government dictate how we're going to get out of this. We can ask them for help. If they help us, fine. If not, we're going to have to figure out our own ways around this. And those kind of things would be very helpful. And so hats off to Matthew 25 Ministries and Tina Knowles to put our nurses, first responders, and hospital personnel in a much better position to be safe as we try to take care of our community.
Yeah, I agree with that sentiment. Special thanks to Matthew 25 and to Tina Knowles-Lawson for organizing all that. I know the Knowles family has, had lived in the third ward community for many years, which is a community that you've served for decades. So it just speaks to the power of connect the Houston community, and how even though we're the fourth largest, even though the Houston community is the fourth largest city in America, it's still a very close-knit community, and everybody just wants to look out for each other, especially in times like these.
Yeah, actually we do. And I have to hats off to Houstonians. We all really pull together, independent of race, color, creed, orientation. I mean, when Harvey hit us, there were people that didn't know each other pulling people out of houses. So we really do pull together. And I have to say, I'm very proud to be part of this community trying to fight this epidemic and be part of the team. It's a good feeling on how we can work together, and hopefully it'll be a model for what needs to happen throughout the United States.
Yeah, most definitely. And my last question to you, what do you want the new normal to be coming out of this? I know we touched on it a little bit earlier, but just looking at the results of the 1918 flu and the aftermath after that, it just looks like there was a change for a few months, years at a time. And then it kind of went back to normal. And as technology evolved, we were still doing handshakes, we were still doing all these things before COVID-19. What do you think the world is going to look like once everything returns to a new normal, if you will?
So let's talk about the positives. The first thing is not just COVID-19 is spread by poor hygiene, it's tuberculosis, hepatitis C, it's all kinds of other things that potentially can be spread. And so I hope that we are going to be a more hygienic society, washing our hands after we walk out of the bathroom. I mean, just simple things like that, cleaning our countertops more often. I hope that while we're sort of maybe overdoing it a little bit now because of COVID-19, I'm hoping that this will be a new norm that we'll be able to keep our society cleaner and therefore more healthy, not just for COVID-19, but for COVID 2021, tuberculosis, all things we already have going on at this point in time. That's the first thing. The second thing is that I'm hoping the society will have now a wake-up call to say that, one, we're never going to let this happen again, that we're not organized for a response, and two, that we're going to have a healthcare industry that will look at everyone equally to be able to have access to testing, treatments, and things like this, because everyone in society counts for something, no matter what you may think. And I'm hoping that we see that as a society. But after we get out of this, I and the medical community can't do that. Society has to look at this and say we need to do differently. And I used the 9/11 analogy. We didn't do all of that stuff at the airport before 9/11. When 9/11 hit, we decided to change the whole infrastructure of travel. One can argue if taking shoes off makes a difference or not, but we as a society says we think that it does. We do not ever want this to happen again. So we're going to do all of these things like this. We need to do the same thing with this epidemic to say what we learned, what we're not, what looks like works, and to make sure that we end up in a situation where we're not in a situation where we are reacting, but one where we can be proactive in our health of our community from here on out.
Yeah, being proactive and organization are, once again, so key in fighting pandemics like these. Thank you so much, Dr. Gathe, for joining me once again. I do enjoy doing these. I definitely learned a lot from you and just picking your brain for these few moments that we have.
Well, I appreciate it. I'm always happy to do it. And I guess we have to make a date for every weekend until we get through this to make sure we get the information out. And I hope we get questions from the audience about how they feel about this, what their communities are doing, what works and what doesn't work, because we all have to bounce these things off of each other. If something's happening in Virginia, it seems like it's working, I want to know about it so I can make sure we can incorporate it here, and vice versa. We need to share what works and what doesn't work so we can try to get through this as a team and all together.
Yeah, share your notes. The final exam is here.
There you go.
All right. Thank you
All
again,
right.
Gathe. I so appreciate it.
Happy to do it, Chloe. You take care. Be safe, okay?
All right. Same to
All
you.
right. All right. Bye-bye.
For more on coronavirus and infectious disease medicine, please visit the links below. Stay safe, everyone.